And with that, thank you so much for being with us today. We are very happy to see you all. This is a great opportunity for us to learn together, provide more information. I'm providing more information, more context. This was financed by the Department of Public Health to understand a little better and also serve a little better the community that speaks Mixteco in San Luis Obispo. At the beginning of COVID-19 with the Department of Public Health Center in providing equitable access to vaccines and the resources to COVID-19 for farmer workers, we discovered that there was an increase, a growing number of farm workers who speak Mixteco here at our county. So it is important for the Department of Public Health to understand and obtain a general description of demographic profiles, living conditions, and also any health challenges that these people face in our county. And for organizations like us can accomplish our mission and provide services that are culturally relevant and and appropriate linguistically here in our county. We are very thankful to the trilingual team who carried out this evaluation. Without them, this would not be possible. So thank you so much. This team that was made up by Micah in this community organizing project. Costa College, and also the University of San Marcos. And with that, I want to introduce Joe Geraldine and also Silvano Vasquez, who will be sharing our findings and our recommendations. Thank you.
Great. Thank you, Leo. This is Joel Derringer. I was privileged to be the project director on this project. It's been 2 years in the making since we first started having discussions with public health, and very excited to present you the latest in the findings. So I'm going to share the screen now, and hopefully we'll get the PowerPoint up. And those of you who've done PowerPoints on the, you realize I can't see you, so you can only see I can only see the screen at this point. So as Leo mentioned, this was a joint project by quite a few people, included Dr. Mario Espinoza Kulik and Dr. Alex Espinoza Kulik, who were at Cuesta College, the Mixteco Indígena Community Organizing Project, or MECOP, and that included Silvano Vasquez, who's will be presenting the findings today, along with Anna and Genevieve and Celeste and Susana. And we worked on this for, as I said, for over a year, and well, 6 months of collecting surveys, but a lot of prior work went into getting it up and running, and a lot of work since then. And also working on the project was Dr. Bonnie Bade at CSU San Marcos. I want to thank our funders again, the Public Health Department, which provided most of the funding for this project, as well as some funding from First Five, funding from individual county board members of the Board of Supervisors who helped with funding the participant incentives. And also there was a number of other funders that Mario had arranged through some grant funding that he had. And now I'm going to turn it over to Silvano to present the slides, and I'll come back in a little bit to talk about recommendations. We will be, after the presentation, having a question and answer session. So Silvano, why don't you start, and I will I'll be working the slides. So let's get going.
Sí, claro, Joe. Muchas gracias. Primero que nada,
Yes, thank you, Joel.
un honor estar aquí,
First of all, it is an honor to be here with you. I feel very happy to present on this project.
hay muchos de ustedes que ya han
I
estado
know there's
como
many of
parte
you
de nuestros, presentaciones
who have been part of
siempre,
uh,
les invitamos
one of our
que
presentations in the past. So we're happy if you bring new questions, new recommendations. Again, I'm very happy to be here. So I'm going to start off by sharing some of the methods we used to carry out this investigation.
Mi equipo formó,
My team
estuvo compuesto de
was made up
mi
of
compañera Celeste,
my peer Celeste and my peer
y
Susana,
yo también quienes participamos
alongside
haciendo las encuestas,
myself, conducting this survey,
frente con las personas.
uh,
Además, se hicieron
having one-on-ones with people.
325
We also had
a las comunidades
325
a
residents
de
answer
San Luis
a
Obispo,
survey,
y esto se llevó a
residents
cabo,
of the San Luis Obispo
entre
County.
abril y agosto.
We did this between April and August.
El mayor número se llevó a cabo como en los
The main
Estuvo
number
cerca con
of
la
service
comunidad,
happened in the summer.
aquí
And also we had an event during the summer, a community event in Paso Robles. All the participants who provided their information, we are very thankful to them for providing their information. Next slide, Joe. In this other slide, I want to show you more about the origin and language of this community. This community speaks Mixtec. It's an ancient language with no linguistic relation to Spanish. It is a language and not a dialect. It's a tonal language, and it has different variants and also regional differences. And the majority of folks who speak this language live in the North County, including Paso Robles, San Miguel, and Atascadero.
Una parte de esta comunidad que habla mixteco, que incluye Nipomo.
Other parts include Neocomo, Rio Grande, and the majority of communities we had the pleasure of interviewing come from Guerrero, Oaxaca, and from more than 100 different hometowns. The majority of them speak Mixteco at home, which is something we were very surprised about because many of us, or many people no longer speak the language. But we're surprised to find out that many of the people interviewed continue to speak the language with their children and also at home. The majority of them moved to the San Luis Obispo County in the past 4 years. Next slide, Joe. This is just a map. This is a map just to show you where these hometowns live. I'm sorry, where these hometowns lie, and some of the people who came from these places are Guerrero and Oaxaca, Mexico. Besides some of these towns in this area, there are many languages indigenous languages spoken, Zapoteco, Nahuatl, Ticles, among others, are still spoken today. Next slide. I would also like to share a little bit more about the demographics. The majority of families interviewed were young, 29 years on average. Many of them in their hometown have very limited access to education, as many of them did not have formal education, don't have a degree. Only about 44% did grade school, which is the most basic in Mexico, which means only 10% of them were barely able to finish high school. Uh, Again, this community work the fields. The majority of them work uh, harvesting grapes, strawberries. Other trades are working in restaurants. We also understand that there is between estimated 3,430,000 and 30,000 to 8,000 Mexican Indigenous people here in this county. Next slide. I would also like to share a bit more about their incomes. As mentioned, the majority of them work in fields, so their income is not very high. Majority of them have an income of 2,500 a month. This is due to, like, for example, right now it's very hot due to heat. Their hours get reduced and they are not always able to work, so their income is lower. Some of them can earn up to $3,000 if they are able to find different jobs. According to the study conducted by Mario Espinosa, who assisted in this study, is that the cost of living in the San Luis Obispo County for a family of four is about $8,183 dollars a month. So cost of living, it's a bit high here in the county. Mm,
Me gustaría también platicarles un poco sobre
I
la
would
experiencia
also like to share a bit more about households.
con pareja y esposo.
63% of them live with a partner or a spouse. 65% have a child, ages 0 to 5. 87 of them have children under 5. Households, oftentimes we discovered that there was 7 to up to 14 people living in one household, and this is due to the fact that some of these families don't meet the requirements or don't have the financials to have a proper apartment. So that is one of the challenges for some of the families. And families, what we see is families supporting other families, and that's how up to 40 people end up living in one house. This is quite concerning for us because oftentimes maybe a child gets sick or a person in the household gets sick, and could another person could get or get in contact with the disease, especially during COVID times. Next slide.
Ahora vamos a platicar un poco sobre la salud.
Now we're
Ah,
going to talk a little bit about health. The most common health problems that we saw in our questions. So before kicking it off, 64% of folks said that they did not have enough money to pay for food in the past year. So those are all the questions that we presented were over the last 12 months. What has been happening? So many said that they did not have enough money to eat. And because of the rain that happened, the floods that happened last year, well, last year and then the following year, when we were doing this investigation, the flooding came, there were heavy rains that fell, and so many of the folks did not have the opportunity to work. And so many couldn't pay for their rent. And so that's why they shared this. And in terms of health, we found that because of not having enough money to pay for food or for rent, there were lots of health problems that came up, like stress, anger, sadness, headaches, among them dental problems. Many had not done any sort of dental exams. And so this is something that happens with all the families that are who tend to have more needs, limited access to services. And so we just wanted to consider this part as well to share it with you all. Next slide, please, Joe. And we post questions also to gauge where people go to receive medical services. And prior to that, I want to share that 54% of folks said that they had never had a physical exam because of the costs for them were quite high. Just a moment ago, we received a mother who didn't want to go do her pregnancy test because she thought that it was very expensive. But then we were able to refer her to a place that was where they were able to support her. So many folks similar to this feel that it's too expensive or that they don't have money to pay for this service. Yes, I want to go do a physical exam, but I don't know how much it's going to cost. And while 65% of folks had never had a dental exam in their lives, 84, many of them not an eye exam either. The minority that does do it are children who do have Medi-Cal and have full coverage. We post questions also with what we see following. Where do you go when you're sick? And majority of them, 30 of them said that they go to CHC. Others go to pharmacies because they just need to buy medication, and with that they'll feel more or less better. And others would go to the hospital either because a mother was gonna have a child or something unexpected, an accident happened. So these are the folks who will be going to the hospital. While a great number of folks visit curanderos, bone setters, folks who do massaging, folks who do bone setting, spiritualist folks. Um, they also, it's something that's cultural that folks go to a curandero or a healer because they feel like they have a lot more trust in those folks to provide care for them. So it's something that we consider to share with you all. Next slide, please, Joe. And let's talk a little bit about health coverage and health insurance. 79% of folks said that they did not have any health insurance coverage, while 15% of them said that they had this coverage provided through their employer, and 6% of them do have Medi-Cal, and those who had Medi-Cal were for emergency cases, and others because of pregnancy, and others had full coverage for their children. In my experience, working with many agricultural workers and speaking Mixteco, many times they don't know or are not aware that they could apply for Medi-Cal, or they even did not know what was covered and what was not. So I can imagine that due to this, many times folks did not access Medi-Cal, but we've been working very hard so that this community can become aware that they can have health coverage starting this January. They can, it could be a lot more accessible. So let's hope that many folks are able to apply for Medi-Cal if they're eligible for it. Also, 49% of folks said that they did receive benefits. There's families that they have children. Those who have children did receive programs like WIC and CalFresh. Next slide, please, Joe. Now I'm gonna share a bit with you all on the obstacles or barriers, because folks sometimes would not attend to a healthcare center or to obtain any medical care. The most common barriers are transportation. Many of them don't have a reliable or own their means of transportation, and others work. Let's say the fathers work, and many times the mothers can't go to their appointments. Others say that it's because it's too expensive. Others because of the language barriers. They can't make an appointment. They don't speak Mixteco, or sometimes they don't speak Spanish. The provider does not speak my language, or others said, I don't have health insurance and I'm afraid to go. As I had mentioned previously, others also are saying that the wait times are too high, that it takes too long. Others because they live too far. Others because they they ask them to make appointments online. And so majority of this community, as I said previously, had some limited access to education. So many of them don't know how to use an email account, a laptop. And so it's very difficult for them to navigate the internet to find the website and make an appointment. They also 31% of folks sometimes say that the providers don't understand their needs and did not explain things to them properly. And others said that they had responses where they were told that appointments were not available. So these are the most common barriers that we uncovered in these surveys that we did. If we could go to the next slide, please, Joe. And I'm trying to be a little brief so that we could have more time for the questions, because whenever we have to present, we have very little time for questions. And I know that y'all have questions. And I also share with you all a little bit of the health concerns that folks have. The heat, excessive heat was the most common because, as I mentioned previously, it was in the summer when we were doing these surveys, and it was very hot, and many were concerned because it's so hot at my job, and I'm gonna get a headache, stomach ache. And so there were folks who were concerned about the heat. Others were concerned with natural disasters like flooding, earthquakes, Others don't receive information to prepare how to call the fire department, or many don't know. That's why they're concerned. Health in the workplace. Also, sometimes there's pesticides, or there's plants that have chemicals applied to them. And when this applied to the plants, folks who are working, that could harm the health of the worker. It could bring many health problems, headache, vomiting, exposure to smoke. Also, it's an area where it's very hot. We see forest fires and different types of fires, and 34% of folks mentioned they were concerned about exposure to smoke. Vaccines, these are concerns that majority of mothers had, because they say that sometimes they don't feel safe. What if the vaccines are safe or not? So I don't have enough knowledge on the matter, and that's why I'm not very trustworthy regarding the COVID vaccines or any other type of vaccine. Other folks said about dental health. No one, folks had never had a checkup, dental checkup. There were many problems with dental doctors and the like. Joe, you could switch over to the next slide, please. Thank you. And in our surveys, we also had questions to ensure that this community can receive information, how agencies can reach them, how they can provide information for them so that they can support themselves, obtain adequate services, and ensure that we understand what we're gonna share. So we would like to know what is the best way. And that's where some folks responded saying that using the WhatsApp application, because through this application they could receive videos, audios, text, images, and that makes it easier for them to communicate. And also, while others said that text messages, because I've had the experience of calling folks sometimes who have an appointment, but they don't pick up because sometimes they're too busy working, or so on and so forth with their work, and they're not able to pick up the phone. While others said that flyers was helpful, that these are okay. They could let us know, and then we could share information that's in the flyers on social media. We would like for the folks said that they wanted information in Mixteco, in our language, while others people said that they listened to radio when they were on their way to work. And so this is a good way also to communicate on our service regarding our services, announcements in indigenous language, and announcements in Spanish also. We can another one of the problems that we uncovered here in the north side of the county is that percentage of folks reported problems with the water, like bad smell, bad taste, ugly color, and they don't have that sort of trust that if I can drink this water or cook with this water. So that's where we found that majority of folks depended on bottled water on a daily basis. So also in their work, they use bottled water. Wherever the water is needed, right? We cannot be without water. So the community found a way to drink water every day. And so according to the data we gather, the community is purchasing more than 1.5 million gallons of water each year, and we are taking into account the 325 surveys. Among those 325 surveys, we have 2,000 members, including children. So there could be more, there, like I said before, 3,000 and 8,000, but we have the capacity to only interview 325 families, and it's okay. Okay, Joel is also going to give you some recommendations and the things that we have been working with other agencies. Many things also have already started to improve, and we hope that soon we're able to serve our community better. And this research is very important for me because through this, as Leo said, we can offer better services and include the indigenous community that exists here in the San Luis Obispo County.
Great. Thank you, Silvano. It's another wonderful presentation. So a question about slides, and yes, we will have the slides available, and we'll get them up on the website, which I will be showing you in a few minutes. We've broken down our recommendations into 3 or 4 different categories based upon what we discovered in the study, as well as what we heard when we had a trilingual community presentation on the findings in October with the Mixtec community, and it was held at Cuesta College in Paso. So first was health access, and it's about reducing the financial, the language, and the cultural barriers to healthcare. You saw the list that Silvano presented, and many of them are about money and availability. So the new Medi-Cal eligibility will be opening up Medi-Cal to all undocumented persons who meet the income eligibility requirements. Will certainly alleviate much of this, but there'll be more because we need to make sure that there's interpretation available and culturally competent providers to work with the Mixteco community. And Silvano is a Medi-Cal eligibility navigator now, thanks to funding from the public health. So we'll be really making an effort to enroll everyone who's eligible into Medi-Cal. Also heard a lot about transportation barriers. So there are a number of things in the county. We have new mobile units that were funded by the county, both with the Newer Clinic and the SLO clinic, reproductive health clinic. So that's one possibility. We have worked on some health fairs. We're bringing providers. The idea is how to bring providers to the community as opposed to everyone trying to get further in off-work hours to providers. And in terms of increasing healthcare capacity, I just mentioned after work appointment times. It's all great and good that there are appointments available from 8 to 5, but as we saw, nearly all of the Mixteco people in the county who we interviewed are working full-time as farm workers. So has to be after traditional business hours, whether it's evenings or weekends, to provide services. Food access, the fact that 64% of respondents said that they did not have food at some point during the year, and these are farm workers. We really need, there's enough food. It's not a availability of food, it's a distribution of food. So we've already been working with food providers such as the food bank to increase distribution of food to the Mixteco population. On a broader level, as a community, we can come together to promote and develop and support community services for immigrants. Those of you who are familiar with the Undocu Support program that we created during the pandemic, we're trying to reach out much more to immigrant populations, and information such as in the survey really helps us focus on where to and perhaps how to provide services to a non-Spanish speaking immigrant population. overcrowding, the housing. Interestingly, while there's severe overcrowding, an average of 7 people in each household, up to 14 in some, no one said that they were actually unhoused. So as we have large discussions about homelessness in the county, we don't talk about the severe overcrowding and dangerous housing that people are forced to live in for many reasons. So they're considered housed, but essentially in unsafe housing. So we really need to incorporate more discussion about overcrowding when talking about housing and homelessness. Silvano mentioned that there were some issues that people reported about the water. We're actually looking at what those issues are, whether they're not feeling safe drinking the water, particularly coming from rural Mexico, or whether there are actual issues. So the county public health has been working with environmental health to investigate and see what actually the issues are. And you'll see when I show you the webpage, we have a map identifying exactly where some of these issues were reported. Moving ahead, now that we've understand what some of the issues are, is what do we do moving forward? So one is improving health communication, basically by phone. Nearly everyone said that they had a phone. As Silvano said, most use WhatsApp or messaging. So it really is trying to get messages out of Mixteco through the phone. Focusing on services for young children and families. The average age, these are recent immigrant young families. Average age was 29 years. 2/3 of the people we interviewed had children, and nearly all of those had children under 5. And remember that most of these folks have arrived in the last 4 years. So it's really critical to focus on services for young families, including the children. Educational opportunity, over half only had a grade school education at most. So there's opportunity both within the school districts to provide for adult education. There's opportunities in higher ed, like through Cuesta in the Paso area, to provide some more opportunities to raise educational and employment levels. Climate resilience or climate change really affected the population. There's excess heat. This was also last year with the flooding, and this affects livelihood. It affects safety in the fields, and it affects safety at home. On COVID, we didn't actually go into the slides on COVID, but there was, despite all the efforts by the county and even hiring trilingual outreach workers, it was fairly low immunization levels and fairly low testing levels. So in the full report, you can read more about some of the opportunities the county has in planning ahead for any future pandemics. So I'm going to turn it over to Anna from MECOP, who's going to talk about, Anna's the director of the Santa Maria and oversees the San Luis Obispo office of MECOP. Going to talk about some of the next steps that MECOP is undertaking with the findings.
Thank you, Joel. Hi, everyone. Thank you so much for giving us the opportunity to present some of these findings with you all on the community that resides in San Luis Obispo County that we serve, the indigenous migrant communities who are primarily farm workers. I would like to say, first of all, that this is, even though the community has been residing in this county for quite a bit now, I feel like this is like a great start. This is a great beginning for all of us to become more aware, continue to learn more, just about, not just about the needs that the community needs and concerns that the community has, but also about the richness in their culture, in their languages, in their foods, in their traditions. It is really, really a beautiful demographic that when we take the time to meet with, live with, hear from, we will be able to learn just really how beautiful these communities are. One of the things that we're excited about and so grateful for is the opportunity to continue learning from the community through Silvano in his position as resource navigator. He will be able to continue to meet with the community. Well, him and our Paso Robles team will be able to continue with working with the community so that we can continue to learn about more needs that were not captured in this in this study. In talking a little bit about the housing needs, for example, again, we just scratched the surface. There's so much more that we need to learn about and do, because the reality is that they are constantly living in fear of losing their housing. Yes, they're housed. Yes, they're under shelter. They have a roof over their heads and so on. However, every day, excuse me, it's a constant struggle or a constant fear of losing their housing. So through our services in our offices, we will continue to work to gain the trust from the community to continue to come and tell us and share with us what is it that they are needing. And we will also continue to work with you all the allies, all the agencies, organizations that have reached out to want to learn from this community. So we are more than happy to continue to do this, whether it's through the team or through events or any other opportunities that we can get. Yeah, more than happy to continue to share what we know, the knowledge that we know, or what we hear directly from the community. We will continue to work with you all to continue to bring not just, again, the awareness in the community, but also that community building to continue to ensure that you all are connected directly to the communities. We know firsthand that you want to provide services appropriately, culturally relevant. So we're more than happy to be that liaison to make that direct contact between agencies and community. What we're also hoping is that this demographic study, these results, the report, what we're hoping is that it can also provide some quick answers. One of the things that we're constantly being asked is, how can we work with the community? What are the languages that are spoken in the community? Is it Mixteco Alto? Is it Mixteco Bajo? How can we better support? What are interpretation services? So we're hoping that, yes, we can relay you to these findings, to the report, and all the context that's provided on the website. We're also happy to just have a conversation with you on who the community are, and again, just what we know. So again, happy to have those just conversations around what the findings are. And also, we will continue to learn from the community on this evolution of the language. So we've identified with this study that primarily that those that are migrating to SLO County are migrating from Guerrero, the state of Guerrero. However, that can quickly change as well. We also identified other languages. There's Amuzgo, there's Zapoteco, there's Purépecha, Nahuatl. we also will be ensuring, we will make sure that these languages are also included in our conversations. So it's not just Mixteco speakers. There's, again, a big diversity of languages. So in our team, in our office, we will continue to study what these languages are, and we'll continue to share with you all as we gain more information. So I'm super humbled and grateful that this study took place, that we are a part of it, and that now we have this report, this website that we can all refer to. So with that, if there are any questions, I'm happy to answer. I'll send it back to you, Joel.
All right. Thank you, Anna. It's been great working with the MECOP staff, and also watch the MECOP staff in Paso Robles grow over time. And so we look forward to continued collaboration. The last thing we want to do today is share with you our website. It's somewhat, well, I don't know if it's unique, but it's fairly unique for our county. It's both in English and in Spanish, and we have some Mixteco audio that you can click on, and for Mixteco speakers to hear it orally. On the website, I'm going to show you just a quick tour. We have the reports, we have summaries, we have a video presentation of a prior presentation, and some maps. We will be posting these slides on there. And I want to, for those of you who are research oriented, we'll be making the data sets will be available on request. So I would use the website contact form for that. I'm going to stop sharing here and go back to, let's see if I can share with the website. Where'd it go? Hold on. Oh, here it is. Staring me in the face. Okay. So the website address is slowmix.org. This is the San Luis Obispo Mexican Indigenous Community Survey. So it's in English. You'll see up here at the top right, it's in English, but it's also in Spanish. And they're not, it's not one of the translations where you click on it and say translate into Spanish or some other language. So it's not a Google Translate. This was actually posted by the team, and it was both Mario and Alex worked very hard on getting the website up. So rather than going through Google Translate, there are independent pages for it. And we have just who the team is. Let's see, pictures of those of us who've been speaking today. Publications. Here, I'll put it on the English one. So we have this both I think, under 10-page executive summary with all of the findings. There's also a full report, and I should say that there are several appendices you may want to look at. One of them was specifically about the sending villages, the home communities in Oaxaca and Guerrero. There's also a map, and I'll show it to you on the water, where we found the water issues, where they were reported. And there's both a lot of data in an appendix as well as on a map. And, oh, so I see the slides are up here from an earlier presentation. They haven't changed much. So for those of you who are asking for slides, they're already on the website. There's also the video from a prior presentation. The news tab has a lot of the news releases articles from earlier when we released preliminary findings to the community in October. And then lastly, just maps. And Alex Espinoza-Kulik and Mario spent a long time putting these together. And you can play with them. One of them is on the sending communities in which from Oaxaca and Guerrero. Oh, wait a minute, here we go. Oh. You can see it's pretty interactive. And the other one identifies where those who responded said that there were water issues. So for instance, here in San Miguel, 42% of those surveyed, and we'd have to go back and look at the text to see exactly how many, because it was probably only, I don't want to guess, but it was a certain number of people, almost half of the people who did respond in the area reported some problem with their water. So the map really should be read along with the text. The map is the visual, but the table in the appendix is what you want to look at as well. So, and then what else? There's just a contact page. So if you have any questions for us, please feel free to post them there. And
sorry, Joel, can you go back to the homepage of the website?
If I see, now you're testing me. Sorry. No, that's not it. Wait, how did I lose it already? Oh, I don't know.
It's okay. It's okay. I just wanted to point out
Oh,
where
Wait, I think I got it. Okay.
the audio in Mixteco.
Ah,
back to the
right. I knew there
homepage.
was a whole reason. Okay.
So if you scroll down,
Yeah, there we are. Why don't you want to talk about it?
there the orange boxes with the triangles, that's audio in Mixteco, and which is provided by Silvano, Celeste, and Susana. And one of the questions again that we always get is how can we provide information in Mixteco to the community? It's always best to do so in an audio or verbally, because another challenge is illiteracy. So some community members don't know how to read and write, so it's best to do pass out information verbally. And it could be as simple as creating a flyer, or in this case, a website, and then incorporating audio explaining what the context is or what the text is. So yeah, we just wanted to show you that it could be this simple, and to make sure that we're being inclusive of the different languages.
Yeah,
Thank you, Joel.
I'll click on one and test it here. So let's, I don't know. Is that Susana or Celeste? So embedded throughout the website are these audio, Mixteco audio. Okay, I think, Leo, we're ready for questions, I think. He's on mute too. Okay, let's open it up. Probably raising hands or somehow getting our attention. We're happy to answer any questions you may have now. And of course, it's on too many screens to actually see everyone.
Marilu Gomez has her hand up.
Mary Lou?
Hi, Silvano, una presentación muy linda. Gracias. Thank
It
you,
was
Joe.
a beautiful presentation.
I just wanted to say that one of the challenges that I've also seen, and I know that Silvano mentioned it in one of the slides, is the fact it's technology. And many of us as organizations or offices that help these indigenous families, we assume, and we shouldn't assume, but we assume that because they have an iPhone, they know how to use it. and really they only use it for calling.
Let's see. I see two hands here. Or does anyone want to respond to Mary Lou?
Yes, I can, yeah. Definitely agree with you, Marilu, that just because they have a smartphone, the community has a smartphone, it doesn't mean that they know how to use all the features on the smartphone. Typically it is used for calling, texting, WhatsApp. In WhatsApp, there's also the audio feature that's also very, very popular to use, a popular app to use both here in the States, but also in Mexico, which is another big line of communication with their families back home, and Facebook. They're also big users of Facebook. Thank you.
I see Lisette, and then let's see, and Carla. So had questions. Lisette? Lisette, I don't know if you want.
Oh, there we go. Sorry, I got the ending of my name, but it cut out the first part. Yeah, hi.
I'm glad I'm not the only one with technical challenges.
Thank you for your study and for having it in both English and Spanish. I do appreciate it. I did have a question if, in specific, any health issues were studied among the population, because I do work in Santa Cruz County with the Childhood Lead Poisoning Prevention Program. And Santa Cruz County, like SLO, is a farm working county. And we do have a lot of families who speak Mixteco and are lead poisoned. And when they come onto our caseload, they're not really sure what lead is. And we tell them that it comes from chapulines and ollas de barro, dulces mexicanos, candies from Mexico, and pottery and grasshoppers. So would the next phase of this study be what specific health issues these families are facing?
I'm hesitating for a supply because this was a reply about the next phase, because there was one-time COVID money, which we are very grateful for, but it has raised a lot of issues, and the public health department is really looking at what else to look at. Whether there's a second phase to this particular study is not certain at all at this point. But I don't know whether Silvano or Anna want to respond to the questions about lead and what the experience is among this population.
Yeah, no, unfortunately, I also don't have a lot of information on that as well. However, I do know it is a big concern amongst the communities. But yeah, no, I also don't have a lot of information.
Abby, I see your hand up. I don't know if it's about lead or I
It
want
is.
to be in the queue. Okay.
It's about lead. If I could quickly answer, I formerly worked, for those of you who don't know, with public health and the lead prevention program there. We did highlight the needs and outreach to the Mixteco population, and we talked specifically about the grasshoppers. It's kind of a few months back. I don't know if Leo or someone else has updated information.
Perfect. Well, if you need a sister county to work with, I would be more than happy to give my input with my experience with the Mixteco population. But I do truly appreciate, because it's given me another point of view to the Mixteco population. So thank you.
Great. Thank you, Lisa. Carla, I see you have a hand up.
Yes. Yes. Hi. Thank you so much for this presentation. It's been really helpful as we start to really understand specifically the Mixteco population and how we can best support them. For those of you who aren't aware, the Access Support Network provides support services to people living with HIV and hepatitis C and harm reduction services. And one of the things that we've seen in the recent years is really an increase in recent HIV diagnosis amongst Mixteco-speaking people. And we are just challenged with how to connect them to linkage to care, given kind of the, I think we're just trying to really understand what the best kind of culturally appropriate way to really encourage treatment and getting connected with providers. And I just wonder if there is information around kind of this and how to support this community that has like these really unique barriers.
I can try to answer or address this question with an example that I can provide, not specifically about this topic, but during the pandemic, in Santa Barbara County, the city of Santa Maria, the farm working community had the highest rate of infections, primarily because they didn't isolate, they didn't stop working, they continued working, but also because there wasn't enough information for them in their language. Therefore, they weren't getting tested. And then when the vaccine came out, they weren't trusting the vaccine. So what the community in Santa Maria, what different organizations, public health department, other CBOs, we all came together to try and mitigate this high rate of infections. Also, because farm workers were dying from COVID. And what we did is we did a lot of outreach where they were at, where they gathered. So we came to them and we ensured that that we acquired the proper, correct information to pass on to them so that they can gain trust in getting tested, in getting the vaccine, in ensuring that their families were vaccinated. So we did a lot of the legwork. Different community organizations did a lot of the legwork to ensure that we went to them and to take the time to hear from them also. What is it that you're hearing? What is it that you're concerned about? Because there were a lot of different misinformation also passed around. There was a lot of things like being shared, like don't get vaccinated because you're not going to be able to have children. Don't get vaccinated because of this, because of that. So the fear was real amongst the community. But we went and provided them other information, and then the community, the indigenous community, then slowly started coming around, started realizing that it was safer to get tested, to get vaccinated. So I can offer that as a model, as an example, that is, if there is information that should be shared with the community for the sake of their health, there are ways that can be done, as long as it's done in their language, as long as agencies, we take the time to learn from them, to hear from them, to understand, to respect their culture, to respect their ways, their traditions, and be there when they are ready, when the community is ready to come to us to get help. When they're ready to seek help, we need to be able to be ready to support them. So hopefully that helps. I know that this topic is particularly tricky given just given the culture, but I think there are ways that can be done. Thank you.
Great.
Thank you so much.
Thanks, Anna. I see two hands, Preston first and then Demetria.
So yes, hello everyone. My name is Preston Allen, and I'm part of a brand new group that just launched during Earth Day. Actually, we had a chance to attend and showcase what we're working on during that event. We're called the San Luis Obispo Climate Justice Alliance, and we're a group of nonprofit individuals and community-based organizations who come together to try to ensure that, in particular, underserved resource communities and underrepresented communities are not left out of the climate conversation. Very much like the situation in Juneteenth, where the people in the South didn't get the memo, And that just created a whole lot of interesting dynamics. We want to make sure that everyone in our community is aware and can make decisions that are important to them about what it is that they need in their best interests. So we center our efforts on under-resourced and underrepresented communities, and we're also are very active in seeking grants and supporting our initiatives through grant funding. We've been pretty successful with that as the other unique organizations that are part of the Alliance group. So my question is, I would love to have someone from this, and perhaps maybe Anna, if you're interested, to come speak with us and meet with us and see how we can assist in getting the word out to our communities, and also, but more important, to our nonprofit and community-based organizations, so they can help get the word out to communities in a way that's kind of a much direct link, if you will, in communicating with communities. And thank you very much for this presentation. It's very helpful, amazing data. Thank you.
Thank you, Preston. Happy to connect.
Preston, maybe you can put your contact information in chat for Anna. Right. And good to hear that there's the group.
All right.
Demetria.
Thank you, Joel. This was a great presentation. My comment is for feedback for Carla, who brought up the diseases about HIV. I had worked with some Mixteco speaking family members concerning HIV and TB. So there really isn't a direct one way on how to educate the community about this. We've had some family members that we, have been diagnosed with HIV, and it really is taking a step way back, really back, where you're having to explain to them what it is first and what it does to the body. Because if you just confirm with an individual that's, hey, you have HIV, they're gonna hear it as if it's like, oh, hey, you have the flu, it's gonna go away, or with treatment, it's gonna go away. You have to inform them of the consistent treatment that they're now going to receive. With the individual that we met for HIV, he was not comfortable. I spoke with him over the phone because our representative, the nurse, was not available or was not able to speak with him in his primary language. So then it was passed down to where we connected with him. I tried explaining to him over the phone of what this was, and to me, it was a lot to just understand in English, reading pamphlets and what HIV is and what it does to the body. So I had to educate myself very clearly to where I can relay the information in Mixteco to this individual. Once I felt like I was educated enough to this, we reached out to the individual to connect with them. I really just told them like, hey, I think this is something you really should hear in private. So then once we confirmed that the individual was then not comfortable meeting at his home, again, he was renting a living room. So there had to be at least maybe 6 more individuals there. We met at a location that he was comfortable in. And we were just going over pamphlets and flyers and blood and cells and everything of what this does to the body. It did take a minute to where the individual then realized like, wow, I am really sick. And this was, of course, after hours, where, he was off after work at 5 o'clock. We probably met like at 6:30 in front of like on the side of a grocery store. And the same thing for TB. They're all working. They can't afford not to miss work. And we want to see them for medication. Like, hey, we need to see you at 12 o'clock. We need you to take medications for your TB, whether if it's latent TB or active TB, but you need to continue treatment for anywhere from 6 to 9 months to a year. They can't afford to come see us at a clinic. So again, we've had to adjust to where we're telecommunicating with them, where we're meeting them with after hours with our field nursing team. So that's just some of the feedback that I have working with the Mixteco speaking population. There is no one way, and it is a struggle, and I feel like it will be a struggle. And until we can figure something out more, education sessions. I'm always hard on education with the population. because they know as much as you're going to provide them. If you just tell them HIV is bad, it's going to kill you, that's how they're going to hear it. They don't know how it's transmitted. They don't know who's contagious, how to reach out for cure for it, or how to look out for symptoms. And yeah, that's pretty much what I have in my feedback working with them.
I appreciate that.
Yes, thank you, Demetrio. For those of you who don't know, Demetrio is the trilingual public health outreach worker who worked all through COVID, the public health department. I think was the first trilingual staff member. Maybe, but he's been hanging in there for a long time and doing a great job. Okay, I see a hand up, Andrew.
Thank you, muchas gracias. Es que yo tengo dos preguntas. Una pregunta sobre como
I
agua.
have two questions, one regarding the water and also the language. I work with young families and I wonder if they are dependent on a lot of bottled water, if there will be something we could do as individuals or as a team in regards to maybe changing systems. If maybe we could offer bottles of water at the end of maybe providing a service. Tell folks we have extra water, they're available. If maybe that's something we could do as individual at an individual level and as teams, which is, to increase the availability of water. And the other question is if there are any opportunities to learn Mixteco, because every time that I go online, searching for resources, it's Mixteco from Oaxaca, and I know that here in the county, Mixteco from Guerrero is the one mostly spoken.
Great questions. I don't know if Ana or Silvano care to answer.
I can leave the language questions to either Silvano or Demetrio.
I can go first.
Gracias por la pregunta. ¿Quieres ir primero?
Thank you for the question. Do you want to take it on, Demetrio?
A ver, the language, it's there's no easy way to learn it. It's its own language. It's the same as learning English, French, German. It's you're gonna have to either find somebody who is really fluent in that and have them be your instructor or educator. It's not something that you can just, try to like repeat. It's a little bit difficult trying from like watching. When I was growing up, Spanish was harder for me. So, my parents would say, "Oh, turn on the TV and then put Spanish media or Spanish news, Spanish radio." And it was a little bit easier because my friends spoke Spanish. Mixteco is the same thing. If you're just hearing it, it's not the same as Spanish. So when you hear words, you don't know what they mean. And I'm just going to say, unless if you have somebody that speaks fluent Mixteco of that region that you're looking for, you're just going to need a full-time instructor or educator, right? Because it is its own language and it's just like learning Spanish or English.
I think that's my question. I think that's my question is, are there any opportunities to learn? Are there any, people that give lessons at any organizations? Because I think that's my whole question, Demetrio, is that I'm not going to just go on YouTube and say, hey, how do you say this in Mixteco and have the perfect answer? So I think that's why I'm asking this question is because I've called different organizations and they've been like, no, there's nothing available. And I've asked an interpreter that I work with and they said, well, you can just text me a phrase if you want to know how to say that phrase. And so what I'm looking for is some kind of, like you said, French or Spanish or German. Well, there's plenty of opportunities to learn French. It's kind of a built up option, but for Mixteco, which is not as built up as some of those other languages, how would someone who works with Mixteco speaking families who wants to be able to say, hey, welcome, please come in. How are you today? Kind of to build trust, because I find working with parents and families and youth, building trust is something that can be difficult when you don't speak the language. And so I think that's why I'm asking this question is, if you're like, oh, actually, I know 2 ladies and 1 guy that works for these 2 different organizations, and I know that they've been open in the past to doing like clases particulares or something like that. So yeah.
Creo que es una muy buena conversación. Puedo sugerir.
This is an interesting topic. I think Mico has an indigenous radio, 94.1. Mixteco is spoken. There are also songs in Mixteco. I encourage you all to tune in. There are also colleagues at work and different agencies who have, commented how well or how good that they find this radio station. I also wanted to mention, and to add to what Dimitri said, it is a difficult language. The only way that the youth are learning Mixteco right now is through their parents speaking Mixteco all the time. It is a difficult language. There is not like a writing form that it's an official writing form. Every family writes it differently. There's not like a standard form. There's different ways and different nuances to the language. So it does depend. Depends on the variant you want to learn, or which families you would like to address or giving services to. So asking where they come from, it's the best way we can maybe connect you to agencies teaching Mixteco. The International Center in Fresno provides Mixteco classes. I don't know if they have this available for adults. I know they are available for children. Maybe that's something worth considering. I'll give you my information. I speak Mixteco from Guerrero. So if I could help you with anything, I'm happy to do so. Although there's different variants, the interpreter that we work with speaks Mixteco from Emnatamok, and she can work with families from Arroyo Prieto and different areas. I keep hearing it's a difficult language because there's different variants. I also have access to other folks who speak it and speak different variants because they come from a specific zone from Guerrero. But thank you.
Thanks. Jasmine, you have your hand up?
Yeah, I had a question. Primero que nada, muchas gracias a todos por todo el trabajo que han hecho.
First of all, thank you everyone for your work, especially with this type of information. I think information is power. And it's powerful that we're bringing so much visibility to many of these communities. I wanted to know if there's an information center where organizations could maybe get some of the data and analyze the data. I know you will be sharing some of the information you're sharing during your presentation, but I work with an organization that advocates for the health of children in California, and we are very interested in any information related to indigenous children in the state. And for that, we need the data and more information around their age, their just demographics basically, so that we have better access to the information.
Yeah, certainly. If you go to the website, the full report and the executive summary have far, far more data than we were able to present on the slides. we can also make the data set available to individual researchers who want to look at it more. But one thing I want to make clear is any data you see here will be about the 325 families or households that we interviewed in San Luis Obispo County. So it'd be hard to generalize it either county-wide or even statewide. But everything, all the demographic data about the people that we were able to interview, and they're, it represented 2,000 Mixteco speakers in the county, but that's what we can represent. There was
Hi there, I have a question. I'm not able to raise my hand for some reason. So I know we just have a couple minutes. Hi, everybody. I'm Calandra Park. I work for the California Department of Public Health, but I live here in San Luis Obispo, and I see some familiar names here. Hello to my Dignity Health colleagues. I miss you all greatly. I know there's no official phase 2, Joel, as you mentioned at the beginning, but I'm still curious to hear how I guess SLO Public Health, I think it sounds like they were the funder, is thinking about next steps and whatever that might look like. Because I feel like it would be such a shame to not capitalize on the momentum and the energy right now. And, with the needs assessment findings, there are some great recommendations. And I think there's opportunity to take it to the next phase. And I'm not trying to put anybody on the spot. I'm just curious to know if have these discussions, happened? Are we talking about what might be happening next? I know at the state level, we're really looking at Indigenous populations and how better to connect with them. It's not an easy solution or an easy task or process or anything, strategy, because it's unique to every single population. So I know that this is a report that we would love to see. Well, it looks like it's already on the website, but that we would love to see and that I would love to share with my colleagues. And also, I'd love to be able to tell them that, we're working on, or SLO County is working on such and such next steps, or considering this or exploring this, even if it's not official. And then just one caveat or one comment that I want to offer is, or just put out there, is that with these additional opportunities for funding, potential opportunities, I really just want to make a plug and hope that, the actual Mixteco folks, their voices and opinions and input are strongly incorporated and considered for programming and for service development.
I'll take it from Leah or Joyce, but right now our primary focus is on language access and ensuring that translation and interpretation for Mixteco speakers is available. And we are updating our work plan in the health equity program. We continue to see what next steps that we want to focus on. And so we are continuing to partner with HI to conduct cultural competence classes and trainings on the Mixtec population. And at this point, we are focusing on just getting the results out to our community so that they're aware of the survey findings or the study findings and can take that under consideration for their programming development. And then we continue to partner with MECOP to provide services and partner on work coming up. So that's just a sneak or a piece of how this is impacting our activities thus far.
Thanks for sharing, Elizabeth. Yeah, I think that's a huge part of it, is just the interpretation piece alone. I worked at Marion for 10 years and I'm very familiar with that barrier. I just lost my comment. Anyway, well, thank you.
Well, this has been a wonderful presentation. We learn every time we present, and we had 75 people on this call. We probably, we're reaching several hundred so far in the county. And we look forward, if anyone wants more if you have any questions after the looking at the report and looking at the data, be happy to answer them. Again, I just want to thank Public Health and particularly Abby, who I've been chatting with, you know, on the call. Abby and I have worked together for many, many years, and it was sort of through her vision and reading deep into COVID manuals about how we could use some health equity money to actually fund a community study, not a survey, it wasn't research, and help the community for a long time to come. And we look forward to implementing a lot of the findings or recommendations over time. I don't know if Leo or Joyce, you have any closing comments, but I want to thank everyone for being on the call today.
Sí, muchas gracias, Joel. Y muchas gracias a
Yes,
todos.
thank you very much, Joel, and thank you, everyone. It was a pleasure to see everyone, to see the energy there, to understand, and to see how we can collaborate and work together to be able to provide services, and so that our communities can feel comfortable, they could feel like they belong, not just to be able to access these services, but that they are members of our community and that they're welcome in our community and that they're part of our community. And we want it to be a relationship of acknowledgement and respect.
Los siguientes pasos, vamos a
And in
enviar
the next steps, we're going to share an email with more information and all the information that was shared here. Please feel comfortable to share with whoever wasn't able to attend today or who is with other members of the community or other organizations. Or send me an email. I'll share my contact in the chat, and feel comfortable to send me an email and communicate with me. So thank you, everyone. Joel, Silvano, Ana, and wonderful to see everyone, and hope you have a great day.
Yes.
Thank you.